A precious moment for first-time mum Chloe Barker and baby daughter Nova from Wisbech. Born early at 32 weeks, Nova weighed just £3 and 2 ounces. The early arrival meant Chloe's breast milk wasn't ready, so she was given the option of donor milk until she was able to express herself.
The first couple of days that she was here, obviously my milk wasn't in because she was so early, so we opted to have the donor breast milk instead of the formula.
Staff in the neonatal intensive care unit at the Queen Elizabeth Hospital in Kings Lynn say donor breast milk can be used as an important stopgap in the early days.
When mums are not able to express their own breast milk, then using donor breast milk allows them to be able to provide their baby with the protective factors that breast milk can give to premature babies and allow mum time without the stress and the worry that she's not managing to provide for her baby.
It's this stress and worry that Nasari John from Kings Lynn has seen herself while expressing milk for her baby son Emmanuel. She now plans to become a donor herself.
I have met other mums when in hospital who didn't have milk and they felt quite down with that and they wanted to use the donor milk. If there is an option, I would like to donate the milk.
And that's what Bryony Liddon from Sprowston is currently doing while breastfeeding her second child, 7-month-old Stanley.
I know how hard it is to get breastfeeding going. When I was struggling with my daughter, if I could have had the option of donor milk just to give me that breathing room to get things started, I know how much of a difference it would have made for me. So to know that I can give that to someone else, it really means a lot.
Bryony volunteered to become a donor with the Hearts Milk Bank, part of the Human Milk Foundation charity.
Hi, good morning.
Today she has 2 litres of milk ready for collection by the charity Norfolk Blood Bikes.
Lovely, thanks. Bye.
The charity is tasked with collecting donor milk outside of NHS hours. The team of volunteer riders are on call across Norfolk to pick up the donated milk and deliver it to a central milk hub in Norwich. So once the donor milk arrives at a milk hub like this at Helsdon Hospital, it's stored in this freezer here. Then it's taken to a central milk bank in Hertfordshire where it's tested and pasteurised. Then it's brought back to the hub again and it's stored in another freezer like this one, ready to be sent off to hospitals and in the community. And it's the community that's the focus of this new pilot project in Norfolk, with donor milk being offered to women at home to improve breastfeeding rates. In Norfolk, around 70% of families start breastfeeding, but after 6 to 8 weeks, that drops by 20%.
Breastfeeding rates are lower in some of our more deprived areas, so areas like parts of Great Yarmouth, parts of Kings Lynn and some wards in Norwich in particular have lower breastfeeding rates. And for some women who may have medical conditions or their babies may be born premature, it's more difficult to feed to sustain that breast milk, so this project is really focusing on both of those key areas.
Lucy Lowe and Jess Ward from the Human Milk Foundation are part of a team working on this project across Norfolk, providing breastfeeding support as well as raising awareness of donor milk with mums and other healthcare professionals.
Working with a small cohort of families linked with the Norfolk and Norwich University Hospital who have diabetes in pregnancy. Those families can sometimes struggle with establishing breastfeeding despite their best efforts. We're able to support some of those families where it's kind of relevant or appropriate with some additional milk in the form of donor human milk.
The charity is appealing for current breastfeeding mums who think they may have surplus milk to become milk donors as part of a large recruitment drive. Demand for donor milk has risen by more than 100% since 2020, and even more so in the last year.
A lot of people don't realise the benefits of donating as well as the benefits of receiving donor milk. So there's a lot of research going on now into the benefits for the donors of milk. There's a lot of positive effects on parents' mental health by being able to donate milk, and that's particularly true for people who've experienced a loss, sadly, or some kind of trauma associated with pregnancy or birth. So that ability to be able to give back and donate can be really positive and really therapeutic for a lot of parents.
The hope is to expand the number of milk hubs in Norfolk from 1 to 3, but that depends on stocks of milk. So more donors are needed to help more families who may want to have the option to use donor milk.
Hi, Frances. What are you doing?
Baby Francis was born at 26 weeks, weighing less than a bag of sugar. Her parents Bethany Rex and Daniel Hooton from Norwich were aware of donor breast milk from their first baby and asked for it when Francis was born.
You know, for her, it's really, ensured her sort of health, her immunity, which is a really big part of what they get in their sort of final trimester of pregnancy, and obviously she didn't get that.
I think it's amazing that mums do that, and has a massive impact on people like us who for various reasons might need that milk at different periods in their sort of feeding journeys.
Bethany and Daniel say they were lucky to have the option to choose donor milk for baby Francis, something they will always be grateful for. Emily Knight, ITV News.